About 25% of healthy newborn babies will experience some sort of feeding problem in the first 6 months of life. Feeding problems cause quite a bit of distress for both the parent and the child, with the child being excessively crabby and crying and waking up constantly in the night. Some of these problems can be easily correctable, but some require some sort of intervention, maybe medication, and very rarely some sort of surgical intervention. The signs and symptoms that kids present or babies present with include excessively fussiness during feeding, or severely arching their back or body during a feeding episode, or choking or gagging or persistently vomiting after feeding. Excessive drooling with feeding is a problem, and if the child is feeding with excessive spitting up and vomiting. Feeding problems result in poor weight gain and growth. So this can range from something simple, for example, in the early days, like incorrect latching in a breastfeeding baby, or incorrect formula preparation in a formula-fed baby, or it can progress to something that requires a bit more intervention or medication, such as a baby who has severe gastroesophageal reflux, or has a cow's milk protein allergy, or a lactose intolerance. Other rare causes that may result in the baby not feeding well could be underlying medical problems like heart problems or respiratory problems, and this needs to be adequately diagnosed and managed. Rarely, there are some surgical problems that need to be corrected, something simple like a tongue tie that needs to be released in order for the baby to latch or suck properly, or something more severe like a stricture or any part of the gastrointestinal tract that needs to be released. Discuss your feeding problems with your pediatrician early before there is poor weight gain or inadequate growth.